Ben. Nice to meet
Hi,
you.
nice to meet you.
My name is Shanna Graydon, and I'm an occupational therapist here.
Okay.
And I heard it looks like you have a radial head fracture that you just found out. It sounds like your elbow must be hurting you quite a bit.
Yeah, I was out playing around on my boat the other weekend, and I came down, I slipped on it, and then I landed on my elbow, and it was bothering me really bad over the weekend, so obviously I went in on Monday morning and had it looked at, and they diagnosed it as a radial head fracture. So basically, yeah, it's in pain, and it's really hard to use my arm right now, and just wanted to come and talk to you and kind of get a better understanding of really what it is and how I can, go about daily life.
Yeah. So that's what I wanted to do is, first off, I want to give you this handout. It explains a radial head fracture. It's also called, you have a Mason type 1 radial head fracture. And what that means is fractures are put into a category type 1 through 4. And it's based on the displacement of the bone. So Mason
So basically, I'm not super bad then. It'd be like if it was a 4, it'd be way, way worse.
Right. So a Mason type 1 fracture is just where you have a fracture and your bone is broken right in the radial head. So here's a good picture of it.
Okay.
See that right there? So
Yeah.
the top of your radial bone that goes up here, you have that's broken there, and the bone isn't really displaced much. It's pretty stable there. So with a Mason type 1, there might be less than 2 millimeters of displacement. But it does cause pain to you, and I'm sure you're feeling that on the outside of your elbow. And
yeah, that's a spot that was like really swelling up on me the most, or at least when I put pressure on it, I noticed it the most is on the outside.
Okay, yeah, and you probably have a little bit of swelling there as well. So with this type of fracture, this is, by the way, the most common type of fracture for people to have. Oftentimes they get it from, just like you did, where they either have an impact right on the radial head of their bone and it breaks, or most commonly somebody falls and they try to catch themselves with their arm out straight.
Yep.
So in prone position, down towards the floor with their palm and an extended arm, and then it breaks the top of that bone.
Okay. I guess, okay, that makes a little more sense to me as to what I'm actually dealing with. I guess the doctor I went to see was pretty quick to go over it with me, and I guess I just wanted to come and talk about what are my limitations with this, like as far as overextending myself or making it worse or doing any further tearing. Because I do a lot of like outside work and stuff. Is that something that I should refrain from doing for a while, or?
Yeah, so what's going to happen here is you do have a broken bone, so we do need to take care of that. And the best way to take care of that is you'll have a sling or a splint for about 1 to 3 days. It kind of depends on what your doctor's orders are.
Yeah, she told me to wear it for 3 days.
Okay, so you'll have that for 3 days, but right off the bat, we're going to start with some active range of motion.
Okay.
Because what that radial head impacts is the extension of your arm and the flexion of your arm, so coming back up towards your body, and it also impacts the rotation of your wrist from supine, palm up, to prone, palm down. So it's hard to twist that arm and bend it up and down.
I should try not to twist it and move it then?
So what I'm going to have you...
like light movements, I guess.
So what I'm going to have you do actually is you'll be in the sling, and you're going to avoid doing any of those actions unless it's part of your exercises that you're going to be getting. Okay, because we want to make sure, one thing that can happen is that if you overuse your arm and you're having too much movement, it actually can cause it to become displaced, and so we don't want that.
Yep.
But research actually indicates that getting that active motion right away adds for a better outcome.
Okay.
And so starting that those range of motion exercises early on will make it so that you have more motion and less pain, actually.
Sure.
For the first few weeks.
So if it starts feeling better, like I probably, past history with myself is I'd start using it, but I'd really just try and refrain, I guess.
Yep.
Okay.
You're going to need to be careful, especially for these first few days.
Okay.
And you're just going to need to pay attention to it, because a little bit of pain when you're doing exercises is okay, but you really don't want a whole lot of pain, because that's going to be a good sign that there's injury there, right?
Okay. Yep.
And you will be given orders of when it's okay to have weight-bearing exercises or
Okay.
weight-bearing activities that you can
Sure.
participate in, and also when you can do some strength, some grip exercises.
So my doctors told me like it would be like 4 to 5 weeks on a heel time. Is that right? Or is it longer or shorter? Or?
So yeah, the heel time is throughout all of it. I mean, it'll be about 6 to 8 weeks
Oh.
before you can, before you will start to do some of those resistive exercises and stretching. And the long-term outcome of this is you should have, full mobility of your arm again. In about 10% of cases, though, there is some lasting occasional pain of the elbow.
Okay.
And so we just want to make sure that we get you on the right track so that you can heal up right.
They didn't really recommend any medication. Should I just be like taking like regular Advil dose or something like that? Or?
Yeah, that's okay to take just some normal over-the-counter pain meds. Obviously follow the directions on the bottle for that.
Right.
One other thing that you may be given is sometimes if there's a lot of swelling, an elastic stocket can be used, or
That's
elastic,
a funny word.
or elastic bandage will be wrapped around there just to hold everything in place and to help with that swelling, to decrease it, because we don't want edema, or what they call swelling, to occur.
Okay.
So I just want you to make sure that you're following those exercise orders and you're not giving too much movement, because we don't want that joint to come out of place at all while you're healing up.
Okay.
Do you have any other questions?
Like the severity of it though, like obviously I'm not worried about anything popping out of place or anything, but would that be more of a higher risk if it was like number type 4 type something, like higher? Is that like more, I guess what's the difference in the like type 1 to 4, like the tear size or like the displacement of the bone, or?
Yeah, so that's exactly it. It's the displacement of the bone. So type 1, I said that it's a stable break and that there's no displacement, or it's very minimal because it's less than 2 millimeters.
Okay.
A type 2 is going to be greater than 2 millimeters and the bone is starting to be unstable.
Sure.
Type 3 is where you're actually going to have multiple breaks in that bone, and that's going to need some surgery to fix that kind of injury. And then a type 4 is going to be multiple breaks where the pieces are unstable and it's dislocated. So that absolutely is kind of part of the criteria.
So basically, like with a type 1, barring, I follow the rules and don't overdo it, I should have a full recovery with this and full movement back? Yep,
you should. In about 10% of cases, like I said, people do have some of that lasting elbow pain that kind of occurs here and there. But 90% of the time, people regain full mobility and don't have any issues.
Okay. I guess that answers my questions then.
All right. Well, Ben, it was wonderful to meet you. Oh,
yeah.
That's your injured arm. I'm sorry.
Yeah.
Ben, it was wonderful to meet you.
Yeah.
I'm going to have you rest that arm, okay?
All right.
Don't worry about shaking hands.
Yeah, good.
And if you have any other questions, you are always welcome to call the hospital, call the nurses, and ask any questions that you have. But,
sounds good.
But this is a really good reference for you.
I will take it. Thank you.
All right. Thank you.
Yep. Great.